to be educated, but I'm so frustrated. Hello to my loneliness. I guess that ignorance is bliss. Take me back to before I knew. Rewind, take it out of cue. Innocence can be a young man's game. Signed up for the hall of shame. I wish I knew how much I miss not knowing.
Ladies and gentlemen, my name is Victor. I'm an RPN, a registered psychiatric nurse. I'm registered with the Nursing and Midwifery Board of Ireland. You're welcome to Mental Health Nursing 101. Once again, I want to say a very big thank you to Legacy TV Dublin for allowing us to use their platform, their studio, to start our own playlist, Mental Health Nursing 101. Please like, subscribe, and click the notification button so that you can view our future uploads. Thank you very much. Today, we're going to be discussing, or we're going to be talking about drug calculation in pharmacology. Drug calculation in pharmacology. The terminologies used in drug calculation, terminologies. So number one, we'll talk about the medication. Like when they tell you that someone has pain, give the person 1 gram of paracetamol or 1 gram of so medication. So number one, medication, that is the name of the drug that you're giving to a patient. What is medication? Medication is a compound that is completing a desired effect, a desired therapeutic effect. For example, when someone has a headache and the doctor says, oh, take 1 gram of paracetamol. So paracetamol is the medication, and what is the work of the medication is to complete a desired therapeutic effect. The therapeutic effect is that if you take the paracetamol, it's going to stop or reduce the ache or the headache. So that is medication. We talk about the dose. So that is how much of the medication is administered. That is the dose. So, or how much of the medication is administered. It's administered. Like when the doctor says give 1 gram of paracetamol. So that 1 gram is the dose of the medication needed to complete the therapeutic effect. So number 3 is the route. So the route is the way or the paths by which the medication enters the body. So the way or the path, the medication, the way, let's just say the way the medication enters the body. For example, if they say PO means by mouth. If they say parectal, so through the anus. If they say IV, that is intravenous. Intravenous. If they say IM, that is intramuscular. And if they say buccal or sublingual, That is under the tongue. Then we have one called topical. That is on the skin. On the skin. What else? There are some for vaginal. That goes through the female private part. That's what else? Subcutaneous. So that goes under the fatty layer. It's under the skin, but under the fatty layer of the skin. Of the skin. So, and there are some other terminologies, like when they say OD. OD means to take one daily. That's once daily. Then we have BD, that you take twice daily. We have TDS, we have 3 times daily. 3 times daily. And we have QDS, that is 4 times daily. Then there's one we call PRN. That can only be given when required. Like PRN, like it can be a pain medication that they say they don't just give it until maybe when the patient asks that, oh, I need this because I'm having pains, I need this, and it might not be a regular medication, but it can be written PRN, that is as required. As required. So there are some drug calculation that they will tell you a patient is taking one medication, maybe 3 milligrams of one medication, QDS, how many tablets of that medication you're going to give throughout the day. So QDS, the person is taking it 4 times daily, and maybe he's taking 3 milligrams once, so times 4, that is 12 milligrams daily. Then that is 3 times 4, that is 12 tablets. So we have to know these terminologies as well. Then I believe you're writing them down. Then after these terminologies, we're now going to go into the formula straight. We're now going to go into the formula. So now we're going to talk about the formula. So the formula is dose required over dose available times, some will call it the volume and some will call it the vehicle. It's almost the same thing. The vehicle can be the numbers of tablets, and the volume can be the volume of the liquid, while the vehicle might be in tablets or in liquids as well. So that is the formula. Number one, the easiest way I can explain this is that the dose required is the dose that you're supposed to give to your patient. What you want to give to your patient. For example, when they said, the doctor said you should administer 20 milligrams of, let's say 20 milligrams of alloperidol to your patient. So that 20 milligram is the dose required. That is the exact amount you're giving to your patient. So you have to understand the question that which one is the one you're supposed to administer. So that is the dose required. Then the dose available is when they said the medication is available in maybe 500 milligrams. The medication is available in 5 milligrams. So the dose availability, the available dose is the one that they said that, oh, you are asked to give this to your patient, but the medication is available in so dose. That is the dose available. Then the volume may be the number of tablets. It may be the volume of the liquid, maybe in milliliters or in liters. So that is that. So that is the formula. But I would like to tell you that if you know your the basic units of mass and volume, and you know the terminologies, and you know the formula, it's going to be very impossible for you to get any question wrong. Now, apart from using this formula, I'm going to teach how to use the formula and how to use another formula. It is a way that people that are very good at mathematics will solve any draw calculation. So it's either you use the formula or you use the other one. So I'm going to be teaching both today. So now I'll be looking at questions that I got from the internet. Now that we know the formula, as the dose required is the one that you're supposed to administer to the patient. Then dose available, that is the dose at hand that you have available, and the volume or the vehicle. So as you know that, I would like to give us about 5 steps that we need to be able to nail every question. Any question, no matter how hard the question may be. So number one is, what exactly are you solving for? What are you looking for in the question? What do they ask you to find? Number 2 is, what exactly is the dose that you're administering for your patients? What are you administering? What dose? Dose are you administering to your patients? Then number 3, what dose do you have at hand? Which one is available for you? Available dose. If you know these 3, then number 4, that can be very tricky, is what conversions do you need to do? Sometimes in a question, you see milligrams, you see grams, you have to convert one to the other. So what conversions, if you don't convert, then definitely you might get the answer wrong. So you have to convert one to the other. So sometimes you see conversions and you see more than one unit of mass or unit of volume in the question. So you need to convert one to one before you can get the answer right. Then number 5 is just solve. Number 5, just solve. So what are you looking for? Number 1. Number 2, what dose are you administering? Number 2. Number 3, what is the available dose? Then number 4, what conversion do I need to do? Then number 5, just solve. Using either the formula method or you use the mathematical method that I'm going to teach. Now, let's go to the first question. The first question says, a patient has received a prescription for penicillin 100 milligram tablets. How many tablets are required to complete their 14-day course of 200 milligrams 3 times a day? This question has nothing to do with the formula. It has everything to do with you understanding the question. I don't want to write the question on the board, but I'll type the question on the, in the video, you're going to see the question. It says, a patient has received a prescription for penicillin 100 milligram tablets. How many tablets are required to complete their 14-day course of 200 milligrams 3 times daily? If you understand the question very well, so the patient is supposed to have 200 milligrams 3 times daily. 200 milligrams. That is what you are administering. And the question, this says, what are you solving for? It says, a patient has received a prescription for penicillin 100 milligram tablets. How many tablets? We're looking for how many tablets. So whatever your answer is, there should be tablets in front of it. So now, That is the first one. We're looking for the number of tablets. What is the second one? What dose are you administering? And the question says, how many tablets are required to complete their 14-day course of 200 milligrams 3 times daily? That is, you're giving a dose of 200 milligrams of penicillin for 3 times daily. So 200 milligrams 3 times daily times 3. That would be, for a day, you need 600 milligrams in a day. 600 milligrams of penicillin. And it says 14-day course. So if one day is, that is for one day is 600 milligrams. So 14 days is going to be 600 times 14. 600 times 14. How much is that? 600 times 14, that would be 600 times 14, 0024, 006, 0048. That's, you're going to need 8,400 milligram. Sorry, 8,400, that is the total milligram that you're going to need for the 14-day course. When the person is getting 200 milligrams 3 times, that is getting 200 in the morning, getting 200 in the afternoon, getting 200 in the evening. That is 600 a day. Then for the 14 days, you're getting 8,400 milligrams altogether. But the question says, a patient has received a prescription for penicillin 100 milligram tablets. So now, when each tablet is 100 divided by 100, I would say is dose required. So 8,400 over 100, that is, each tablet is 100 milligram of penicillin. So when you divide that, so that will give you 84 tablets. That is the answer. You need 84 tablets to give, because the tablets are in 100 milligrams, but you need altogether 8,400 milligrams. So let me do it again. The main thing is for you to understand it. The main thing is for you to understand it. It says, a patient has received a prescription for penicillin 100 milligrams. That is to say, the dose available is in 100 milligrams. So how many tablets are required to complete their 14-day course of 200 milligrams 3 times daily? So you have 200 milligrams at once, but 3 times daily. That is 200 milligrams times 3 times daily equals to 600 milligrams per day. That will be 600 milligrams per day. Then we're looking for 14-day course. 14-day course will be 600 times 14. That will be 8,400 milligrams. That is the total number of milligrams. Remember, the question says a patient has received a prescription for penicillin 100 milligram tablet. That is to say, they are in hundreds. You only have 100 milligram per one. So if they are 100 milligram per one and you need 8,400 milligrams, you just divide by 100. So all you need is 84. The milligram will divide milligram. So that will be 84 tablets. That is the answer. That is the number one. So what are you solving for? We are looking for the number of tablets. What are you administering? You're supposed to be administering 200 milligram. But in a day, altogether is 600 milligram. The available dose is in 100. That is why we're dividing by 100. Then what conversions do you need? You don't need any conversion in there because they are all milligrams. Then you solve. That is the first one. Number 2. It says, a healthcare provider orders amoxicillin. Amoxicillin is an antibiotic. A healthcare provider orders amoxicillin syrup for an 18 kilogram 4-year-old boy. 18 kilogram 4-year-old boy. 4-year-old boy. Okay? years old child, sorry. The dosage required is 25 milligram per kilogram per day. Remember, the guy is 18 kilogram and they said the dosage required is 25 milligram per kilogram. That is, if it's 25 milligram per 1 kilogram. So what dose are you going to give the child? Because the child is 18 kilogram. That would be 25 times 18. Yeah, 25 times 18. So 25, 18, 5 times 8 is 40. 4, 16 plus 4, 20. 5, 2. That's 450. That is 450 milligram. You're giving 450 milligram per day. And the dosage required is 25 milligram per kilogram per day divided into 2 doses per day. So you have to divide this into 2 doses because it has to be given 2 doses per day. That is 450 milligram per day. So you're going to be giving it BD twice daily. So to give 450 daily, that will be 450 divided by 2. That would be 225. So equals 225 milligram BD. That is twice daily. Then the question is, the available stock suspension has concentration of 90 milligram per day. So what is available is 90 milligram per meal. That is, we have the concentration of 90 milligram of the medication in 1 milliliter of the liquid. 1 milliliter of the liquid has 90 milligram of the medication, that is amoxicillin. So to use this formula, what is the dose required? We need to give this once, 225. 225. What is the dose available? It is available in 90. In 90 milligram. Then what is the volume or the vehicle? That is times 1. So if we use calculator to divide that, that is 225 over 90. Let me see. That's 2.5. Let me see. 5 here. It's better to use your calculator to solve it. 5 here will be 1, 8. 5 here will be 4, 5. 9 will go 2. 9 will go 5. 2 here 1. 2 here 2.5. So that will be 2.5. So a healthcare provider. So how much do you administer per? So 2.5 milliliters. 2.5 milliliters. So let me go over it again. It says a healthcare provider orders amoxicillin syrup for 18 kilogram 4-year-old child. The dosage required is 25 milligram per kilogram. So the child is 18 kilogram. Then the dosage required is 25 milligram per kilogram. So times 25. 8 times 5, 40. 9, 16, 1, 2, 3. That's 450. That is 450 milligram is needed. Then the question now says, excuse me, the dosage required is 25 milligram per kilogram per day divided into 2 doses. So we have to divide this into 2 doses. It has to be given twice daily. So dividing 450 into 2, 450 into 2, that would be 225. That would be 225 milligram. Maybe 1 in the morning, 1 in the evening. Then the available stock suspension has concentration of 90 milligram per meal. How much do you administer? So now, 225 milligram is the dose required to give. 225 milligram is the dose required to give. Then the dose available is 90 milligram per meal. Then multiplied by 90 milligram per 1 meal. So the volume or the vehicle is 1 meal. So if you do your calculation here, you're going to get 2.5 mil. So 2.5 milliliters of amoxicillin syrup is going to be given. That is it. That is the second one. Let me look at the third one. Now, a patient is prescribed 0.075 grams of medication. How many 25 milligrams tablets should be administered? Now, a patient is prescribed, so what is the dose required? The dose you're going to give to the patient is 0.075 grams of medication. How many 25 milligrams tablets should be administered? Let's just say you have all the medications in 25 milligrams. That is in 25 milligrams. Now, remember what I said to you then? How many tablets? That is X. Now, remember what I said to you that what are you solving for? And the question is, how many 25 milligrams tablets should you be administered? That is what you're looking for. Then, what dose are you administering? A patient is prescribed 0.075. That is 0.075 grams is what is prescribed. Then, the next one, available dose, they are available in 25 milligrams. Then, the next one said, what conversions do you need? What conversions do you need? Remember, this is in gram and this is in milligram. If you do it like this, you're going to get it wrong. So the first thing is either you convert this to gram or you convert this to milligram. I think it is better to convert to milligram. So 0.075 gram to milligram. 0.075 gram to milligram. You're going down, so you're multiplying. So what do? You're multiplying by gram to milligram. You're multiplying by 1,000. So 0.075 grams times 1,000. You can use your calculator. Like for me, I will just count 1, 2, 3, then 1, 2, 3. That is 75 milligram. So all you just need to do is to say 75 milligram. That is the dose required. Then dose available is 25 milligrams. So they are both in the same unit. Now, then you can divide 25 in this. 5 in 25, 5. 5 in 75, 2, 1. That's 2 remaining. No, sorry, 1. 1 remaining 2. In 25, that is 5. 5 here, 1. 5 here, 3. So the answer is 3. And what are we supposed to look for? So how many 25 milligrams tablets? So you need 3 tablets. You need 3 tablets. That is it. That is it. Let's go for the next one. The next one says, how many microliters are in 3.5 milliliters? They just want you to convert 3.5 milliliters to microliters. I think we did it once. Converting 3.5 milliliters to microliters, all you need to do is multiply by 1,000. That is 3.5 times 1,000 into brackets microliters. 1, 2, 3. 1, 2, 3, 0, 0. That will be 3,500. 3,500 microliters. That is very simple. We've done that before. 3.5 milliliters to microliters. So milliliter is greater, microliter is lower. So you're going from the larger to the lower. So what do? You multiply. You multiply by 1 milliliter equals 1,000 microliters. So you multiply by 1,000. So that is it. That is that. Then the next one, you have an order to administer 40 milligram of methadone subcutaneously for opioid detoxification. You have an hand 30 milligram per mil. How much should you draw into the syringe? So you have an order to administer 40 milligram. So what are you solving for there? How much should you draw into the syringe? You're solving for the liquid, for the volume of the liquid that you're going to draw into the syringe. What dose are you administering? And it says you have an order to administer 40 milligram. You just write 40 milligram. 40 milligram over dose available. And say 40 milligram of methadone subcontinentally for opioid detoxification. You have at hand 30 milligram per meal. 30 milligram per 1 meal. So that is the volume, 1 meal. So to solve for this equals, so it's going to be 40 over 30. 0 will cancel 0, 4 over 3. So the answer should be 1.3333 mil. That should be the answer. It's very straightforward. There's no need for you to convert. What are you solving for? You're looking for the volume. That is in milliliters. What are you administering? You're administering 40. That is what you're giving to the patient. Then just remember, dose required is what you are giving to the patient. Dose available is how the medication, the volume or the dose that is available at hand. That is what is there. So they're telling you you're going to administer 40 milligram and that they have it in 30 milligram per meal. In 1 milliliter, you have 30 milligram. So they ask you to solve for the volume. That is that, 4 over 3. That is that. What is the next one? The next one says a physician writes a prescription for codeine for a patient in which they need 90 milligrams delivered intramuscularly through intramuscular injection. You have codeine at hand at 60 milligrams per 2 milliliters. How many milliliters should you give? What are you looking for? What are you solving for? You're looking for the volume that you're going to give. Then what are you administering? A physician writes a prescription for codeine for a patient in which they need 90 milligrams to be administered. So that is 90 milligram. Now, over the dose available, it says you have codeine at hand at 60 milligrams in 2 milliliters. So your dose available is 60 milligram. The volume in 2 milliliters. That is your formula. So what are you going to do? So it says 90 over 60 times 2. 2 times 90, that will be 180. 180 over 60. So 0 will cancel 0. 6 here 1, 6 here 3. So that will be, you have 3 milliliters. That is the answer. 3 milliliters. So what are you solving for? You're solving for the volume of the medication you're going to give. What are you administering? You are administering 90 milligram. Then what available dose do you have? You have it in 60 milligram in 2 meals. 60 milligrams in 2 meals. That is that. Then what conversions? There's nothing to convert because you have milligram and milligram. You have milliliters. So the next thing is just for you to solve. And that is the... Now, the next one says, a clinician has written an order for digoxin for the client, but you cannot read whether the order is for 0.25 milligram or 0.125 milligram or 125 milligram. What action would be the best to prevent a medication error? The best thing is just to contact the clinician to clarify the illegible order. Just to, contact the clinician, clarify from the person that prescribed it or the prescriber. Let us do one more before we go. Now, how much morphine should be drawn up? That is, what are you solving for? You're solving for the liquid, for the volume of the liquid to be drawn up. It says how much morphine should be drawn up for an 8 milligram dose. That is, you want to give 8 milligram. That is why you're drawing it up. So you're giving, the dose required that you want to give to the patient is 8 milligram. Then, how much morphine should be drawn up for an 8 milligram dose if stock ampoules is what you have in your trolley. If the stock ampoules contain 20 milligram in 2 milliliters, that is, dose available is 20 milligram in 2 milliliters. That is all. You just solve for it. 8 times 2, 16. 16 over 20. Let me say 4 here, 5. 4 here, 4. 4 over 5. What is 4 over 5? I believe that is 4, 5, 1. That is 1, 1, 0. 4 in 10 points 2 is 2, 8 in 20. 1.25 got to 1.25 milliliters. That is what you're going to draw up. That is it. Very, very simple. The main thing is know your formula, but if we don't want to use the formula and we want to solve the same question, it says, how much morphine should be drawn up for an 8 milligram dose if stock ampoules contain 20 milligram in 2 milliliters? What I have to say mathematically, I'll just say 20 milligram equals 2 milliliters. Then we're looking for what to drop if we're going to give 8 milligram. 8 milligram equals x. We don't know it yet. What do? We cross multiply. If you cross multiply, 20 times x is 20x. 8 times 2 equals 16. So to find x, we divide both sides by 20. 20 will cancel 20, then x equals 16 over 20. So we still came back to almost the same thing. That is solving it mathematically. So I wouldn't say this is the end of it all because we're going to do another. I wouldn't say this is the end of it or we're still going to do another one on draw calculation so that you'll be able to know it very well. You should be able to answer any questions either with the formula method or in the mathematical way. The mathematical way is very, very easy, but for those that don't really understand it, you might find it very hard. But the main thing is you have to understand the question. How do you understand the question? You know what you're looking for. You cannot be looking for number of tablets and you'll be getting 3 milliliters. No. You know what you're looking for. Is it the number of tablets? Is it the volume in milliliters? What are you looking for exactly? Or you need to know what dose you are administering. What you're really administering, you need to know the available dose at hand. Then you need to know if there's any conversions that you need to do. If there are conversions and you didn't do the conversions and you're just calculating, you're going to get it wrong. So check for what you're solving for. Check for the dose that you're administering. Check for the available dose at hand. Then check for any conversions that you need to do. Then the next thing you need to do is solve. By the time you solve it, you're going to get the question right. Next time we're going to come on this draw calculation, we're going to be solving many questions that by the end of it, after watching this video 1 or 2 times and watching the next one that I'm going to be uploading, I believe you're going to be very, very good at draw calculation. Any questions at all? Or if you think you have any questions as well that you think you're finding hard to solve, you can send it to us probably on the comment. You can comment with the question. Then we'll see what we can do. We'll solve it during the next one. My name is Victor. Thank you very much for watching. Please, if you know you've gained something from these lectures, try and subscribe with us. Subscribe with Legacy TV Dublin. Like our videos, subscribe, and click the notification button. Thank you very much.
I like to be educated, but I'm so frustrated. Hello to my loneliness. I guess that ignorance is bliss.